Regarding its use as a rasayana, wherever probably tissue building is required, like post-tuberculosis patient or chronic lupus, or even in like osteoarthritis with the old people, in those cases, it can be given as a kind of a rasayana and tissue rejuvenating herb.
See, this is one of the important Sandhaniya Dravya, as mentioned by even Charaka. I have observed and I have used these in particularly gastric ulcers. So, ulcer is once again we call it as a discontinuation of the anatomy, and that is nothing but it may be even in case of a fracture, it is almost same. So, it is Astibhagna, it is Mamsa. So, anywhere in these kind of when we consider this as a Bhagna type of thing, there is a discontinuation. So in those areas, Yastimadhu plays a very important role. And Yastimadhu, in particularly with in cases of respiratory system issues, particularly there is an we call it as urakshata. There is one condition. There is a damage or tissue damage or even the injury to the pulmonary tissues. So in those conditions, definitely it has a very important role to play, and we will, once we use them, definitely the improvisation takes place very rapidly and the tissue rebuilding occurs very fast. So that is a very clear natured material, that is rasayana, and it is very good for the stomach as well as the respiratory system, and even where there is a wear and tear. So in those wear and tear areas, definitely it can be used.
Regarding wherever I require to be required to use spices, but patient is having very sensitive stomach, maybe due to gastritis and all. I would use, and wherever Tikta Dipana is not much useful, I have to use say Hingwastaka Chuna, Aptrikatu Chuna, etc. Even Pipali, for example. I would use Yastimadhu as kind of a buffer or a hedge or a balancing herb to counter the any excessive pitta aggravating effect. So that's a good idea, sir.
Say that can be made, but when we are using or mixing two herbs which are with quite contrast virya, sometimes may not go in hand. So if you are combining any such two drugs, try to get any information from the classical text where our acharyas have made the combinations, and in those combinations somewhere if they have mixed these two drugs, then don't hesitate to mix. That is our idea or the base for that. If acharyas are never mixed these things, then don't do it. See, very clearly acharyas have said, whenever you are using shilajatu, don't mix up kulatta. Very clearly said. But unfortunately, some of the companies, they have come out with a drug in a combination with kulatta, shilajatu, punarnava, manjista, everything has been added into that, and targeting on the urinary system. That's a very wrong way of presenting. That may, because it is not going in the line with our acharyas have described it. Our acharyas have given various combinations. Try to analyze those combinations. Whether the acharyas have put all these drugs together, then you also make a combination which is very similar to that. Otherwise, sharp acting or penetrative drug which should not be taken against a mild acting or a counterproductive drug to be mixed with and making a combination that may become virya viruddha and may be counterproductive instead of giving a good results. You should be very choosy in selecting those combinations.